Question 1. A 62-year-old male with type 2 diabetes presents with diabetic polyneuropathy affecting both feet. I. E11, 40, G63. B. G63, E11, 40. C. E11, 42. D. E11, 42, G99, 0. Answer C. E11, 42. This question tests the understanding of combination codes for diabetes and its manifestations. The key clue is diabetic polyneuropathy, which indicates a direct manifestation of diabetes. ICD-10-CM Guidelines direct coders to use combination codes whenever a single code can fully describe both the condition and its associated manifestation, eliminating the need for separate codes. E11, 42 accurately captures type 2 diabetes mellitus with diabetic polyneuropathy, making it the most specific and correct choice. Remember to always look for combination codes first when a relationship between two conditions, like diabetes and its complications, is clearly documented. Question 2. A patient is seen in the emergency department after falling off a ladder, sustaining a closed displaced fracture of the shaft of the right tibia. Initial encounter. I. S82, 221A, W11, XXXA, Y92, 000. B. S82, 221A. C. S82, 224A, S82, 225A. D. S82, 222A, W11, XXXA. Answer B. S82, 221A. This question focuses on accurate injury coding, including laterality and encounter type. The critical information includes closed displaced fracture, shaft of the right tibia, and initial encounter. S82, 221A specifically codes for a displaced transverse fracture of the shaft of the right tibia, initial encounter, which matches all aspects of the documentation. While external cause codes, W11, XXA, are often used, the primary diagnosis for the injury itself is S82, 221A. For this type of question, the most specific injury code is the focus. Always choose the most specific code that captures the site, laterality, type of fracture, and encounter. Question 3. A pathology report indicates a biopsy specimen from the breast shows ductal carcinoma in situ cyst of the left breast. I. C50 912. B. D05 12. C. C50 012. D. D05 02. Answer B. D05 12. This question assesses knowledge of neoplasm coding, specifically differentiating between malignant, benign, and in situ. The keyword in situ is crucial here, indicating that the carcinoma cells are confined to the original site and have not invaded surrounding tissue. D05 12 represents ductal carcinoma in situ of the left breast, correctly reflecting the in situ nature and laterality. Remember that in situ neoplasms are coded from category D05, not the C codes for malignant neoplasms, because they have not yet become invasive. Question 4. A 45-year-old patient presents with chronic migraine with aura intractable without status migrainosus. I. G43 109. B. G43 111. C. G43 E19. D. G43 E11. Answer D. G43 E11. This question tests detailed coding for migraine headaches, requiring attention to specific clinical descriptors. Key terms are chronic migraine with aura and intractable. G43E11 specifically identifies chronic migraine with aura intractable without status migrainosus, accurately capturing all documented aspects. The detailed subcategories within G43 allow for precise coding of migraine type, presence of aura, and whether it is intractable or involves status migrainosus. Always drill down to the highest level of specificity provided in the medical record for conditions like migraines. Question 5. A 70-year-old male with a history of prostate cancer, status post-prostatectomy 5 years ago, presents for a routine follow-up examination with no signs of recurrence. I. C61. B. Z080. C. Z09. D. Z0881. Answer B. Z080. This question assesses the correct application of Z codes for follow-up care after malignant neoplasms. The critical information is follow-up examination and no signs of recurrence after a past malignancy. Z080 specifically designates encounter for follow-up examination after completed treatment for malignant neoplasm, aligning perfectly with the patient's scenario. Remember to use Z08 codes when the treatment for the malignancy is completed and the patient is only being monitored for recurrence, rather than Z09, which is for follow-up after other treatments. Question 6. A patient is admitted with severe sepsis due to methicillin-resistant Staphylococcus aureus, MRSA, pneumonia, developing acute kidney failure. I. R65, 20, J15, 212, and 17-9 B95, 62. B. A 41-9, J15, 212, and 17-9 B95, 62. C. A 41-02, J15, 212, and 17-9 R65, 20. D. R65, 20 A41-02, J15, 212, and 17-9. Answer D. R65, 20 A41-02, J15, 212, and 17-9. This question tests complex sequencing rules for sepsis with associated conditions and the identification of the infectious agent. When severe sepsis is documented, the code for severe sepsis, R6520, must be sequenced first, followed by the code for the underlying infection, A4102 for MRSA sepsis, and then codes for any organ dysfunction, and 17-9 for acute kidney failure, and the specific MRSA organism, J15-212 for MRSA pneumoniae. Always prioritize the severe sepsis code first, then the underlying infection, then any organ dysfunction, and finally the organism. Question 7. A 60-year-old patient with essential hypertension and stage 3 chronic kidney disease, CKD, is seen for routine management. I. I10-N18-3. B. I12-9-N18-3. C. I12-0-N18-3. D. N18-3-I10. Answer B. I12-9-N18-3. This question tests the specific coding guidelines for hypertension with chronic kidney disease, CKD. When hypertension and CKD are both present, and a cause and effect relationship is documented or assumed, a combination code from category I12 is typically used. Since the stage of CKD, stage 3, is known but not specified as with end-stage renal disease, I12-9, hypertensive chronic kidney disease with stage 1 through stage 4 chronic kidney disease, is the correct combination code, followed by N18-3 for the specific stage. Always look for the combination code when hypertension and CKD are present, and then code the specific CKD stage. Question 8. A patient is admitted with acute exacerbation of chronic obstructive pulmonary disease, COD. I. J44-0, J44-1, B. J44-1, C. J44-9, J44-1, D. J44-1, J44-9. Answer B. J44-1. This question assesses the use of combination codes for conditions with acute exacerbations. The phrase acute exacerbation of chronic obstructive pulmonary disease, COD, indicates that a single code exists to capture both the chronic nature and the acute worsening. J44-1 precisely codes for chronic obstructive pulmonary disease with acute exacerbation. There is no need for separate codes for chronic COPD and its acute exacerbation, as the combination code fully describes the condition. Always prioritize combination codes that fully describe both the chronic condition and its acute exacerbation. Question 9. A patient with HIV disease presents with Kaposi's sarcoma. I. B20, C46, 9. B. C46, 9, B20. C. B20, C46, 0. D. B20, C46, 1. Answer I. B20, C46, 9. This question tests the specific sequencing guidelines for HIV disease with associated conditions. According to ICD-10-CM guidelines, when a patient has HIV disease and develops an HIV-related condition, B20 human immunodeficiency virus, HIV disease, must always be sequenced first. Following B20, the code for the HIV-related condition, which is C46, 9 for Kaposi's sarcoma, unspecified site, is then assigned. The primary rule is that B20 is always sequenced first, regardless of the reason for the encounter, if an HIV-related condition is present. Question 10. A patient presents with acute abdominal pain of unknown origin. I. R10 9. B. R10 0. C. K66 9. D. R10 1. Answer I. R10 9. This question highlights the appropriate use of symptom codes when a definitive diagnosis has not been established. The key phrase, acute abdominal pain of unknown origin, signifies that a specific diagnosis for the cause of the pain is not yet determined. R10-9 accurately represents unspecified abdominal pain, making it the most appropriate choice when a more specific site or type of abdominal pain is not documented. Remember to use symptom codes when a definitive diagnosis is not yet confirmed and more specific codes are not available. Question 11. A 75-year-old female patient with malignant neoplasm of the lung presents with anemia due to the malignancy. I. C34 90. D63 0. B. D63 0. C34 90. C. D64 9. C34 90. D. C34 90. D64 9. Answer I. C34 90. D63 0. This question tests the sequencing of codes when anemia is due to malignancy. According to ICD-10-CM guidelines, when anemia is specifically documented as being due to a malignant neoplasm, the malignancy, C34 90 for malignant neoplasm of unspecified part of bronchus or lung, should be sequenced first. Following the malignancy, D63 0, which codes for anemia and neoplastic disease, is then assigned. This guideline ensures that the primary underlying condition, the cancer, is identified first, then its direct complication. Question 12. A 32-week pregnant patient is admitted for preeclampsia with severe features. I. O14 12. Z3A 32. B. O14 10. Z3A 32. C. O14 13. Z3A 32. D. O14 2. Z3A 32. Answer I. O14 12. Z3A 32. This question assesses accurate coding for obstetrical conditions, including gestation week. The key information is 32-week pregnant patient and preeclampsia with severe features. O14 12 specifically codes for severe preeclampsia, second trimester, which aligns with 32 weeks gestation falling within the second trimester for coding purposes. Additionally, Z3A 32 should be used to specify the exact weeks of gestation. Always ensure that the obstetrical code reflects the trimester and that an additional code for gestation weeks is included if applicable. Question 13. A patient develops nausea and vomiting after accidentally taking too much of their prescribed opioid pain medication. I. T40 to X1A R11 2 X42 XXXA. B. T40 to X2A R11 2 X42 XXXA. C. T40 to X3A R11 2 X42 XXXA. D. T40 to X4A R11 2 X42 XXXA. Answer B. T40 to X2A R11 2 X42 XXXA. This question distinguishes between poisoning, adverse effect, and underdosing and requires correct external cause coding. The phrase accidentally taking too much indicates a poisoning, specifically an accidental poisoning by an opioid, which is coded T42X2A. The symptom nausea and vomiting is coded with R11-2, and the external cause, accidental poisoning by opioids, is coded X42XXXA. In cases of poisoning, the poisoning code is sequenced first, followed by the manifestations, and then the external cause. Question 14. A patient is documented with a stage 3 pressure ulcer on the left heel. I. L89-613. B. L89-610. C. L89-623. D. L89-620. Answer: I. L89-613. This question tests specific coding for pressure ulcers, requiring attention to site, laterality, and stage. The key details are stage 3 pressure ulcer, left heel. L89-613 specifically codes for a pressure ulcer of the left heel, stage 3. Accuracy in coding pressure ulcers requires precise identification of the anatomical site, the laterality, left, right, or bilateral, and the clinical stage of the ulcer. Always ensure all 3 components are represented in the chosen code. Question 15. A patient with confirmed COVID-19 infection develops viral pneumonia. I. J12-89U071. B. U071. J12-89. C. J12-89. D. U071. Answer: B. U071. J12-89. This question tests the specific sequencing guidelines for COVID-19 with associated manifestations. According to ICD-10-CM guidelines, when a patient has confirmed COVID-19 and develops pneumonia, the code U071 COVID-19 must be sequenced first. Following U071, the code for the manifestation, which is J12-89 other viral pneumonia, is then assigned. This sequencing ensures that the primary condition, COVID-19, is always identified first when it is present and linked to other conditions. Question 16. A patient who is experiencing homelessness and lack of access to healthy food is seen for exacerbation of their chronic condition. I. Z59-0, Z59-4. B. Z59-0, Z59-4, code for chronic condition. C. Z59-0, Z59-4, R63-3. D. Code for chronic condition. Z59-0, Z59-4. Answer: D. Code for chronic condition. Z59-0, Z59-4. This question addresses the use of Z-codes for social determinants of health, S2H. While it's important to document S2H, these Z-codes, Z59-0 for homelessness and Z59-4 for lack of adequate food, are always sequenced after the code F for the primary condition or encounter for which the patient is being seen. The reason for the encounter, in this case, the exacerbation of a chronic condition, should always be listed first. Always prioritize the main reason for the encounter, then add Z-codes for relevant social determinants of health to provide a comprehensive picture of the patient's situation. Question 17. A patient with diabetic macular edema, due to type 1 diabetes mellitus, presents for an eye exam. I. E10-359, H35-32. B. H35-32, E10-359. C. E10-359. D. E10-351. Answer: D. E10-351. This question tests the use of combination codes specifically for diabetes with ophthalmic manifestations. The presence of diabetic macular edema caused by type 1 diabetes mellitus points directly to a combination code. E10-351 specifically codes for type 1 diabetes mellitus with proliferative diabetic retinopathy with macular edema, covering both the type of diabetes and its specific eye complication. Always look for the most comprehensive combination code that describes both the underlying diabetes and its specific manifestation, including the presence of macular edema, Question 18. A patient is admitted for bacterial pneumonia. During the hospitalization, the patient developed sepsis due to the pneumonia, which was not present on admission. I. J18-9, A41-9, B. A41-9, J18-9, C. J18-9, A41-9, T81, 4XXA, D. A41-9, J18-9, R65, 20. Answer B. A41-9, J18-9. This question tests the coding of hospital-acquired conditions and sepsis sequencing when it develops during the encounter. Since the sepsis developed during hospitalization and was not present on admission, it is sequenced first as the principal diagnosis for this encounter, A41-9 for sepsis, unspecified organism. The bacterial pneumonia, J18-9, which is the underlying cause of the sepsis, is then coded as a secondary diagnosis. Remember that if sepsis develops during the encounter due to a localized infection, the sepsis is sequenced first, followed by the localized infection. Question 19. A patient is diagnosed with primary open-angle glaucoma, moderate stage, in both eyes. I. H40, 10x2, H40, 10x3. B. H40, 11x2, H40, 11x3. C. H40, 10x2, H40, 10x2. D. H40, 10x2. Answer D. H40, 10x2. This question tests the precise coding of glaucoma, including type, laterality, and stage. The key details are primary open-angle glaucoma, moderate stage, and both eyes. H40, 10x2 specifically codes for primary open-angle glaucoma, bilateral, moderate stage. ICD-10-CM provides combination codes for glaucoma that include laterality and stage, so a single code often covers both eyes if they are at the same stage. Always select the most specific combination code that captures the type, laterality, and stage of glaucoma. Question 20. A patient presents to the emergency department after sustaining a non-displaced closed transverse fracture of the distal shaft of the right radius due to a fall, initial encounter. I. S52, 321A, W19, XXXA. B. S52, 521A, W19, XXXA. C. S52, 521A. D. S52, 522A, W19, XXXA. Answer C. S52, 521A. This question focuses on detailed fracture coding, requiring attention to specific location, type, laterality, and displacement. The crucial elements are non-displaced closed transverse fracture, distal shaft of the right radius, and initial encounter. S52, 521A precisely codes for a non-displaced transverse fracture of the shaft of the right radius initial encounter, while an external cause code, W19, XXXA for unspecified fall, could be added. The question primarily tests the accuracy of the injury code itself. Always select the most specific fracture code that identifies the bone, location, type, displacement, and laterality. Question 21. A patient presents with acute exacerbation of severe persistent asthma. I. J45, 50. B. J45, 51. C. J45, 901. D. J45, 41. Answer B. J45, 51. This question tests specific coding for asthma, including type, severity, and exacerbation. The key terms are acute exacerbation and severe persistent asthma. J45, 51 is the correct code for severe persistent asthma with acute exacerbation. This is a combination code that fully describes both the type and severity of asthma, as well as the presence of an acute exacerbation. Always ensure that the asthma code selected accurately reflects all documented components, including severity and the presence of any exacerbation. Question 22. A patient is seen for routine follow-up after receiving a heart transplant 6 months ago. The patient is currently stable, and no complications are noted. I. Z94, 1, Z09. B. Z94, 1, Z08, 81. C. Z48, 21, Z94, 1. D. Z48, 21. Answer D. Z48, 21. This question tests the correct use of Z-codes for specific aftercare following an organ transplant. The patient is undergoing routine follow-up after receiving a heart transplant. Z48, 21 specifically codes for encounter for aftercare following heart transplant, which perfectly matches the scenario. It's crucial to differentiate between general follow-up codes, like Z09, and specific aftercare codes, like Z4821, that indicate ongoing care related to a procedure or transplant. Always choose the most specific aftercare code available for post-procedural or post-transplant care. Question 23. A patient presents for their first cycle of chemotherapy for newly diagnosed metastatic lung cancer. I. Z5111, C7800, C3490. B. Z5111, C3490, C7800. C. C3490, C7800, Z5111. D. C7800, C3490, Z5111. Answer I. Z5111, C7800, C3490. This question assesses the sequencing rules for encounters for chemotherapy. When a patient receives chemotherapy, the Z-code for the encounter for antineoplastic chemotherapy, Z5111, is always sequenced first as the primary reason for the encounter. Following Z5111, the code for the metastatic site, C7800 for secondary malignant neoplasm of unspecified lung, is then listed, followed by the primary site of malignancy, C3490 for malignant neoplasm of unspecified part of bronchus or lung. Remember that for chemotherapy encounters, the Z-code for the encounter always takes precedence over the malignancy codes. Question 24. A patient is admitted with septic shock due to an E. coli urinary tract infection. I. A 41, 51, N39-0, R65, 21. B. R65, 21, A41, 51, N39-0. C. N39-0, A41, 51, R65, 21. D. R65, 21, N39-0, A41, 51. Answer B. R65, 21, A41, 51, N39-0. This question tests the sequencing of codes for septic shock due to a localized infection. When a patient has septic shock, the code for septic shock R6521 is sequenced first, indicating the severity. This is then followed by the code for the underlying infection, A4151 for sepsis due to Escherichia coli, and then the code for the localized infection itself, N39-0 for urinary tract infection, site not specified E. This specific sequencing ensures that the life-threatening septic shock is prioritized, followed by the bacterial sepsis, and then the original source of infection. Question 25. A patient is diagnosed with major depressive disorder, recurrent, severe without psychotic features. I. F33, 2. B. F33, 3. C. F32, 2. D. F32, 3. Answer I. F33, 2. This question requires specific coding for mental health disorders, distinguishing between single and recurrent episodes and their severity. The key terms are major depressive disorder, recurrent, and severe without psychotic features. F33, 2 accurately codes for major depressive disorder, recurrent, severe without psychotic features. Mental health codes often require careful attention to qualifiers like single versus recurrent, severity, and presence or absence of psychotic features for precise coding. Always choose the code that captures all documented aspects of the mental health diagnosis. Question 26. A patient is seen for chronic kidney disease, stage 5. I. N18, 5. B. N18, 4. C. N18, 9. D. N18, 6. Answer: I. N18, 5. This question tests the specific coding for chronic kidney disease, CKD, stages. The crucial detail is stage 5 CKD. N18, 5 specifically codes for chronic kidney disease, stage 5. ICD-10-CM provides distinct codes for each stage of chronic kidney disease, emphasizing the importance of documenting and coding the exact stage for accurate data collection and patient management. Always ensure the specific stage of CKD is identified and coded using the corresponding code. Question 27. A patient presents for a routine general medical examination and no abnormalities are found. I. Z0000. B. Z0001. C. Z00129. D. Z008. Answer: I. Z0000. This question assesses the correct use of Z-codes for routine examinations when no medical problems are discovered. The phrase routine general medical examination and no abnormalities are found is key. Z0000 specifically codes for encounter for general adult medical examination without abnormal findings. This code is appropriate when the primary purpose of the encounter is a preventive exam and no health concerns or abnormal findings are identified. Remember that Z-codes are crucial for documenting encounters that are not related to treating an active disease or injury. Question 28. A patient is admitted with chest pain, and after extensive workup, the cause remains undetermined. I. I29. B. R079. C. R074. D. I20. Answer: C. R074. This question emphasizes the appropriate use of symptom codes when a definitive diagnosis cannot be made. The critical information is chest pain and cause remains undetermined, even after a workup. R074 accurately represents chest pain, unspecified, and is used when the specific cause of the chest pain is not diagnosed. It's important to use symptom codes like R074 when a definitive diagnosis has not been established, even after evaluation, rather than assuming a cardiac-specific code. Question 29. A 78-year-old patient with osteoporosis sustains multiple pathological fractures, one of the left humerus and one of the right femur, during a mild fall. I. M8022A, M8051A, M80X1A, M80X2A. B. M8022A, M8051A. C. M80X2A, M80X1A, M8022A, M8051A. D. M80X1A, M80X2A. Answer: B. M8022A, M8051A. This question tests the coding of pathological fractures due to osteoporosis, including multiple sites and laterality. The key details are osteoporosis, multiple pathological fractures, left humerus, and right femur. M8022A, osteoporosis with current pathological fracture, left humerus, and M8051A, osteoporosis with current pathological fracture, right femur, are the correct codes, as they combine the osteoporosis with the specific fracture site and laterality. Each pathological fracture is coded separately, incorporating the underlying osteoporosis. Question 30. A 28-week pregnant patient develops gestational diabetes requiring insulin, initial encounter. I. O24, 419, Z3A, 28, Z79, 4. B. O24, 419, Z79, 4, Z3A, 28. C. O24, 411, Z3A, 28, Z79, 4. D. O24, 411, Z79, 024, Z3A 28. Answer C. 024, 411, Z3A 28, Z79, 4. This question assesses coding for gestational diabetes with a specific treatment regimen. The essential information is 28-week pregnant patient, gestational diabetes, and requiring insulin. 024, 411 specifically codes for gestational diabetes mellitus in pregnancy controlled by insulin. Additionally, Z3A 28 is used to indicate the 28 weeks of gestation, and Z79, 4 is for long-term, current use of insulin. It's crucial to select the specific code that reflects the control method, insulin, diet, or unspecified D for gestational diabetes. Question 31. A patient is seen for dermatitis caused by an adverse effect of a prescribed antibiotic. Initial encounter. I. L27-0, T36, 95XA, Y92, 239. B. T36, 95XA, L27-0, Y92, 239. C. L27-0, T36, 95XA. D. T36, 95XA, L27-0. Answer D. T36, 95XA, L27-0. This question tests the sequencing for adverse effects of drugs. When an adverse effect occurs from a properly administered medication, the adverse effect code is sequenced first. T36, 95XA, adverse effect of unspecified systemic antibiotic, initial encounter, is the primary diagnosis, followed by the manifestation, which is L27-0, generalized skin eruption due to drugs and medicaments. In adverse effect scenarios, the T-code indicating the drug class and adverse effect is always sequenced before the symptom or manifestation. Question 32. A patient with Parkinson's disease is experiencing dyskinesia due to their long-term use of levodopa. I. G20, G2402, T42, 6x5A. B. G20, G2402. C. G2402, G20, T42, 6x5A. D. T42, 6x5A, G20, G2402. Answer I. G20, G2402, T42, 6x5A. This question tests complex coding for Parkinson's disease with drug-induced dyskinesia. The primary diagnosis is Parkinson's disease, G20. The dyskinesia is a manifestation of the long-term drug use, which is coded as G2402, drug-induced dyskinesia due to other drugs. Additionally, an adverse effect code for the specific drug class T42, 6x5A for adverse effect of other antiparkinsonism drugs, initial encounter, should be included as a secondary diagnosis to fully explain the situation. When dyskinesia is drug-induced, the underlying condition, Parkinson's, is primary, followed by the dyskinesia, and then the adverse effect code for the drug. Question 33. A patient presents with pain due to a mechanical complication of their prosthetic right hip joint. Initial encounter. I. T84, 84XA, M25, 551. B. M25, 551. T84, 84XA. C. T84, 84XA. D. M25, 551. Answer I. T84, 84XA, M25, 551. This question tests coding for complications of prosthetic devices. The key phrase, mechanical complication of their prosthetic right hip joint, indicates a device complication. T84, 84XA, pain due to internal prosthetic devices, implants and grafts, initial encounter, is the correct code for this scenario. While the patient also experiences pain, M25, 551 for pain in right hip, the T-code for the complication itself is the primary diagnosis when the pain is directly caused by a device issue. Remember to always sequence the complication code for the prosthetic device first, followed by any associated symptoms. Question 34. A patient is diagnosed with refractory angina pectoris. I-20, B. I-28, C. I-29, D. I-22. Answer D. I-22. This question tests the specific coding for types of angina pectoris. The term refractory angina pectoris is a specific diagnosis within the angina spectrum. I-22 is the dedicated code for refractory angina pectoris, distinguishing it from other types like unstable or unspecified angina. Precision in coding angina requires selecting the most specific code that describes the clinical type documented by the physician. Always look for specific descriptors when coding conditions like angina, as there are distinct codes for different types. Question 35. A patient is seen for routine monitoring of long-term anticoagulant therapy. I. Z7901. B. Z7902. C. Z79-2. D. Z79-899. Answer B. Z7902. This question assesses the correct use of Z-codes for long-term drug therapy. The key information is routine monitoring of long-term anticoagulant therapy. Z7902 specifically codes for long-term, current use of anticoagulants. These Z-codes are important for capturing ongoing medication use that may affect patient care or indicate a chronic condition being managed, even if the primary condition requiring the anticoagulant is not the focus of the current encounter. Always use these specific Z-codes to document long-term medication use.